there, my name is Jessica. I'm going to be your nurse today. Hi Mom, can you please confirm your name and date of birth for me? Yes, you did, thank you. And I'm just going to check your ID band. ID band right here. Okay, perfect. I'm just going to check the number against the baby. Okay, 58754, that's correct. Okay, and I'm going to put some gloves on. So I'll put gloves on. Okay, so I'm just going to check it against the baby's ID bands. So we'll just double check, but let's see here. Okay, checking the cards, that is correct, and the umbilical clamp is also the correct number. Okay, perfect. Okay, so I'm just going to be doing an assessment on your baby today. Normal for every shift to just take a look. So let's get my stethoscope. So this would be a neonatal stethoscope, and I'm just going to do it while the baby is sleeping, so that there's no interruptions in the breathing and heart rate. So I'm going to listen for 1 minute to the heart. Should be between 110 and 160. And I'm going to listen for the lungs for 1 minute for 30 to 60 respirations per minute. Okay, that's good. Perfect. And I'm just going to be inspecting the head. Make sure make sure the nose is patent, eyes are symmetrical, ears are in line with the eyes, and the mouth is not dry or cracked. There's no abnormalities. The head is symmetrical. The sutures are overlapping, but that is okay. That is normal. I'm looking for discoloration, cuts, abrasions. I see none of those. Now I'm going to just be looking at the chest. So the chest, there is no retractions. There it is symmetrical. It looks fine. There's no abnormalities. And let's see here. The baby is now moving her arms, so there's a range of motion there. That's evident. And again, I would have gloves on, so I'm just gonna uncover here. Her clavicle is not broken, nothing wrong with that. So I'm just going to be assessing her lower half now. Assessing her umbilical clamp, so that is intact. Her umbilical cord is not dry, infected, no foul odor, no discoloration. Okay, her range of motion for her lower legs is good. She's moving around like that. I'm just going to be inspecting her genitalia. Her diaper is not soiled. Her genitalia is not looking swollen or red or anything like that. I'm just going to be turning her over to look at her spine. Her spine has no spots of hair, dimples, nothing to indicate abnormalities with her spine. Her gluteal folds are both symmetrical, as well as the folds on her legs. I'm looking for creases in her feet. Okay, I can see that she has creases in her feet. And before I started, I would have taken her axillary temperature and put the thermometer between her her axilla. Okay, and that beeps. It was 97.5, which is in the normal range. Okay, and I'm just going to listen to her lung and heart sounds on her back now, which I would have done when I had her turned over. Okay, so I'm going to listen for 1 minute for her lungs, 1 minute for her heart, and I'm going to listen to her bowel sounds for 1 minute in each quadrant. It is a neonatal stethoscope. The diaper is not soiled, so we don't need to change that. I'm assessing her entire body to make sure to see if there are any Mongolian spots, red port wine stains, any marks, scrapes, abrasions. She has a little bit of cyanosis in her hands and feet. That is normal. It will go away within a few days. Everything looks symmetrical. She has free range of motion with her legs. And I am now going to swaddle her. So I'm just going to redo her blanket. I will be doing blood pressure later on. And then later we will also, she already has her temperature, her weight and length recorded. So I will do those, they've already been done, So we'll just swaddle her back up here. Okay, so I'm just going to take my gloves off, wash my hands, make sure everything is okay here, and document all of my findings, document her vitals and everything, and skills complete.